We offer breast augmentation, which is essentially breast enhancement or breast enlargement. There's a lot of women that may have not developed a lot of bigger breast tissue that they feel they're out of proportion in the rest of their body, and this can kind of put them back in proportion. Something that we do that's very common is either a breast reduction or breast lift. A lot of women that have gone through childbirth, nursing their baby, have lost a lot of that volume and also become more loose, and we can add some volume back and also tighten up the breast skin with a breast lift. Rhinoplasty, or essentially nose surgery, can be also a life-changing experience for a lot of people that have had some deformity in their nose, sometimes even functionally been able to not breathe as well. Facelift involves a lot of things that we do these days in terms of tightening up the skin, which involves not only the skin itself, but also the underlying structures of the skin that we can adjust to essentially put somebody's face back 10 to 20 years. We don't stop the aging process, but we can turn it back a little bit. In addition to the bigger operations, we sometimes can also help with just skin tightening or some wrinkles that people form by having too much animation in certain parts of their face that creates what we call dynamic wrinkles that are formed with high muscle tone. We can help those with Botox. We can also plump out certain areas that have developed some loss of volume with things like fillers such as Juvederm, which is a brand of filler that's hyaluronic acid. There's a lot of other surface treatments such as exosomes and platelet-rich plasma that we can use to help the surface of the skin become tighter and smoother and remove a lot of blemishes in addition to the direct surgery that we do. So we have somebody first come in for the consultation, get a sense as to what the operation will work out for them. Then we have them come back and kind of solidify what they'd like to have done, and then make sure that they're healthy to be able to tolerate operation. Some of the things that we offer are what we call minimally invasive or non-invasive, with little downtime or less downtime, and those don't really need a lot of preparation. But if somebody needs something, for instance, like a tummy tuck or a facelift, we need to make sure that they're healthy enough to be able to have the operation performed. After that, the operation, we give them some instructions on recovery. There is some downtime for a lot of the bigger operations, but certainly we have to go over some complications. With any kind of operation, there's always a risk of infection or bleeding afterwards. Certainly with infection, we give people antibiotics to try to mitigate that or decrease the chances of that happening. But for most operations this day and age, we can control it ahead of time. In addition to the certification of our operating room, which gives people the sense that they have safety involved with their care, we've also assembled a really great team of people, professional healthcare professionals, from nurses to nurse anesthetists and technicians that can help with everybody's care and give everybody the greatest experience that they can have and feel comfortable about their care. If anybody has any questions about their care or desires or goals, feel free to give us a call and ask questions. We're more than happy to answer them for you.